My name is Brad Heineck. I'm a physical therapist and a certified strength and conditioning specialist. And what we're going to go through today is fitness using the exercise ball. As a physical therapist, I've worked with thousands of back patients as well as other therapists who work with back patients as well as other patients, and the exercise ball or stability ball has a number of different names and can be a very useful tool for strengthening and stretching someone in therapy. And in the last 5 to 10 years, personal trainers have now started to use them because they realize the benefits you can get using a stability ball. Okay, they're outstanding for the price. You can buy one for $15 or less, and you can get as much exercise and strengthening you can get out of a stability ball as you can out of a $500 or $1,000 weight set that you can buy. When I work with patients in the clinic, I cannot tell you how many times they come up to me and they see the ball on the rack and they say, "What do you do with those balls anyways?" I see them around and I just can't imagine what you would do with these balls, and it's a great question, and that's what you're going to learn in this video. I'm going to teach you how to work with this ball, and not only that, I'm going to teach you how to work with this ball so you can strengthen and stretch the muscles in your core, the ones that are supporting your back, and we're going to focus on the low back because that's the part that's most injured, and upon recovery of a back injury, it's a great tool for rehab as well. It works on both sides. It prevents injuries as well as works with rehabbing injuries in the back as well as other parts of the body. So that's what we're going to do, and we're going to start in the supine position or laying on their back, and we're going to work from there. It's going to be a step-by-step procedure, and you're going to feel very comfortable with an exercise ball and what to do with it. And before we actually get started, I do want to have one word of caution. If you are presently having or dealing with an injury, this would not be a good time to start working on the exercise ball. Consult with your health provider, whether it's a physician, a therapist, or chiropractor, and make sure that it's a good time for you to start with the ball. Now, upon purchasing your ball, you want to make sure you get the right size. The size of the ball, they usually are rated in centimeters. 55 centimeters, 65, 75 centimeter, but you got to watch out because one manufacturer 65 centimeter may be different than a 65 from another manufacturer. That's just the way it is. I found that out the hard way. But when you have the ball inflated, it should be inflated to the point where if you push down, you cannot push way into it, and it should not be real firm where you cannot push into it all. And that's something you get a feel for. When you get the right size ball, you'll sit on it, okay, and there should be a 90-degree angle in your knee here and then also in your hip, but primarily in your knee. If you're sinking too low down, I'm going to exaggerate this, so your knees are crunched up towards your chest. That's too small of a ball, or you need to inflate it. Okay, so that's ball fitting for yourself, and there's a little bit of variability. It's not an exact science. Okay, what we're going to do is start down in the lying position on your back, the supine position. So what I like to do is do this without any shoes on. You can use shoes on if you like. Stocking foot is fine, or even barefoot if you like. Do it in your house. Carpeted floor works great. Okay, first thing we're going to do is find a comfortable position on your back. First muscle group we're going to work is those abdominal muscles. You take your legs over the top of the ball, and then get your knees about a foot to 2 foot apart, about a foot or so, and then you're going to grab the ball, lay down, relax your head. We're working the abdominal muscles, and you simply hug the ball with your legs and lift it off the ground like so. And that's the exercise, working those rectus abdominis muscles, working on that six-pack. And as you do this, you're going to think about breathing. As I'm talking, it's hard to do that, but I'll demonstrate here. You breathe out as you bring the ball up. And you can count, and that way you know you're breathing out. 7, 8, 9, 10. And I would recommend 15 to 20 repetitions of that particular exercise. And again, in the same supine position, we're going to, again, focus on the abdominal muscles as well as the hip flexors and work into the shoulders. On this one, you're going to roll the ball out a little bit, okay, and you're going to squeeze it between your knees or your calf.
Now, the unique thing about the ball is you can change the intensity of the exercise by changing where you work with the ball. I'll show you how this works. We're going to, first of all, go in this position, squeeze it between your knees here, and lift it up. That's a great way to work the abdominals. But next thing we're going to do is do the pass up, grab it with your arms, let your legs back down, bring the ball over your head, give you a stretch with your shoulders, come back up, grab it again with your legs, bring your hands back down, so we're getting range of motion with the shoulders, working the full abdominal anterior muscle group, and work it like so. Now if you want to make this more difficult, if this is too easy, you can do 20 reps, and it's too easy, then you're going to bring the ball way out to your feet, and bring it down. And again, thinking solid core here. Don't let the back arch up here. Keep it down. If you're working to keep your back down, it's too hard. Bring the ball in close. If this is your first time working with the ball, do it easy and just do little passes like this. Okay, you don't have to do the full range of motion. Okay, that's once you get started. You've been working at it for a month or two. Okay, very good.
Now, while we're staying down on the carpet, this next exercise is going to be good for the trunk, the whole core, but we're going to focus on the hamstring muscles. Now, the hamstring muscles are oftentimes neglected with strengthening, and they can become weak and add to problems with knees as well as backs, because they work right from the knees, are connected to the cross the knee and go all the way down and connect to that sit bone. We call it the ischial tuberosity in the back, but that muscle can be worked very, very specifically with the ball. First thing you can do is just start out rolling like this. What we're doing here is simply ranging out the knees, the hips, and the hamstring muscles are working here very lightly. Good way to warm them up. Next thing you do is you're going to lay down, put your hands palm down out to the side for stability. Okay? Roll the ball up to here, and if this is the first time you worked your hamstring specifically, do it just like this. You're going to simply push down with your heels into the ball and come back up. And you're going to do 15 to 20 reps of that. So it's going to look just like this. This is a initial starting hamstring strengthening exercise. Okay? The next thing you're going to do to make it a little more difficult as you progress in strength is you're going to bring it out to here, and you're going to push down. Now look at my buttock is coming off the floor a little bit, and you're going to pull the ball towards your bottom and then bring it back out. Now this doesn't look like much, but when you do this, you're going to find out it can be very challenging if you haven't done it before. All hamstrings are working with this. It's a great hamstring. And tighten up the tummy muscles, because those muscles need to stabilize while you do this. As this gets easier, then you put your hands across your stomach, you're going to find there's a big change with that. It's hard to tell in the video, but once you start working with it, it's true. Okay, and when you get more advanced, you're up here on the ball and you're doing this hamstring strengthening exercise. Hands up here, even make it more difficult. This is pretty advanced. You won't get into this unless you've been working with the ball for a couple, 3 months at least. Okay? And very good. That covers working with the hamstrings. Okay, next we're going to the seated position. You sit on the ball, good posture, shoulders back, okay, arch the back here slightly, feel strong in the ball. Now if you have not been on the ball before, you're going to want to have a piece of furniture or something to hold on next to you so you feel comfortable, because it is wobbly. That's one of the benefits of using the exercise ball. It's wobbly. It forces a number of muscles to work just to keep you upright and stable. It's an excellent benefit. So have something to hold on to, and if you feel comfortable, then you're going to work it like this. We're just going to work pelvic rotation here, forward and backwards. Okay, it's going to help the muscles in the low back, loosen them up a little bit, strengthen them. Then you go right to left. Okay, so I'm not moving my whole body here, but try to isolate that pelvic motion, kind of like doing a hula hoop. Have a little fun with it, then you'll work that hula hoop motion around to the right, go the other direction to the left, and I would do about 5 to 10 repetitions of each of these just to get that low back warmed up, loosened, and some slight strengthening as well. Then we're going to go back to that tall, strong position, and we're going to work our kicks. Okay, take your one leg, doesn't matter which one it is, hands on the ball or for balancing on a piece of furniture, whatever you may have, and simply kick out. Bring your toes up, you'll feel stretch under here and back down. Kick up, toes up, and actually pull your toes towards your nose a little bit, and you'll feel an additional stretch. You might as well get 2 birds with 1 stone, and we're doing kicks. And you're going to count 1, 2, 3, 4, 5, 6, 7, all the way up to 20. Okay, from that point you can bring your feet back down, get that good strong posture again, and we're going to go to marching. And up, and up, and up. And if this is too easy, take your hands off and cross them across your chest. And it makes a difference. It may not look like it, but I'm working harder now than I am here. Okay, very good. And once you feel comfortable doing that routine in the seated position, the way to advance it to get your arms a little stronger is get some dumbbells. I have some 2-pound dumbbells. 1 or 2 pounds is a great weight to start with. Okay, and if you're doing your kicks, if you simply hold your arms out like this, that's one way to start. Okay, do your marching. Okay, then we can go into working curls. Okay, you can do the curls independently, or as you feel more comfortable and you want to have more of a challenge, you do it while you're kicking or while you're marching. Okay, great. Now moving on from the seated position, again, always thinking about that back posture. Good habits for back health is back posture. Now we're going to roll forward on the ball. Now if you haven't been on the ball, you really need to hold on to something, so you're going to feel very wobbly in this position. Okay, I work with a lot of people initially, and this is not comfortable until you've been on the ball for a few days. Okay, but once you are, you'll feel very comfortable. Now, this position, what I do, and I have people do, is just simply lay on it, let your head relax on the ball, and you can arch the back and reverse curve, and that can be a very healthy stretch for your back. It just reverses what you've been doing all day if you've been sitting, particularly at a desk job, or if you're doing a lot of bending and lifting. Just a good, general, comfortable stretch. Okay? Then from this position, we're going to go right into the hips, those glutes, and low back strengthening. Be in this position, your bottom's going to be down a little bit, but your feet will be out wide. Okay? Hands will be crossed and on your stomach, and you simply bridge up. This is a lot of glute and low back and hip strengthening, and we're really working some calories, because we want to burn some calories, work on back strength, and get everything in one job, and that's what you can do on the exercise ball. So we'll do 10 to 20 reps of this. If you just started, 10 will be more than enough. Okay? And then from there, we're going to work the abdomen in another position. Cross the hands here and just do little sit-ups. Okay, that's all you need to do is baby sit-ups. We're working those muscles, and we're going to work the obliques now. So first we go forward for the rectus, and then right elbow to left knee, left elbow to right knee. Again, this one is a little more advanced. You won't want to do it until you're comfortable on the ball. Okay, make sure you breathe while you do your exercises. Okay, very good. And then to get up from there, roll up. And you might need something to hold on to. Get back into this position, catch your breath. And as you feel comfortable with that particular exercise on the bridging position, take your dumbbells out, get them in your hands, go down into that position. Make sure your head is not way up here because you don't want to get your neck muscles overtired and sore. Take the dumbbells in your hands. Do not touch them together. You want to keep them 1 inch apart, slight bend in the elbows, and we're going to work flies. Out like this, you'll feel stretch in the pecs, and then we're going to come back up and work flies just like this. This is a great exercise for that upper body, arm strength, and do 10 to 20 of those. And breathe out when you go up, breathe in when you come back. And remember, you're not going to do these fast. This is the cadence you'll want to do them at. Good control creates good strength. And then come back up, and you'll learn to get in this position very comfortably with practice.